Welcome to America's Heroes Group.
And welcome to America's Heroes Group, this time with our roundtable and our partner, Jesse Brown, and their program called the Jesse Brown VA Works. May is Mental Health Awareness, Military Appreciation, and Asian Pacific Heritage Month, and happy Mother's Day tomorrow. Today is Saturday, May 13th, 2023. Our host is Kelley. You heard him at the top of the hour. I'm Sean Claiborne, the co-host. I'm the executive producer, Glenda Smith, but filling in today is Shakaya, doing a great job, and also a studio engineer. Digital media producer Ivan Ortega of the wonderful Scouts Honor Productions. And we have our panelists with us, Praseetha Harilal. Did I say your name right? I think I said your last name wrong. Can you hear me?
Praseetha Harilal.
Harilal. Okay, that's better. Now I have a reference. So Harilal, Praseetha Harilal. She's a nurse and with the maternity care coordinator at the Jesse Brown VA. And Asya Brodsky. She's a licensed clinical social worker with the Women's Veterans Program Manager. We're going to talk about maternal health. I've never been pregnant, never had given birth. So I'm kind of, not too experienced with that. I tried, but it didn't work out. But tell me, what does the Jesse Brown VA do with maternal care? What is the program all about?
Hi, this is Praseetha. So our gynecology department provides first trimester care, and then they place the referrals to the community to continue the maternity care there in the community. So many veterans continue to receive their health care through VA to manage their coexisting conditions. But we also provide like mental health services, nutrition services, physical therapy, pharmacy services to the prosthetic department to our pregnant veterans. And we also provide lactation package for them, also like blood pressure machine or glucometer if needed. We also provide those things too.
Yeah, and this is open for any veteran who's pregnant or expecting. Now, tell me, what are the benefits, some of the maternity benefits that you offer to the program? And Ida, maybe you can take this. I'm not sure who takes this question.
Sure. So maternity benefits are available to all veterans, those who are enrolled in VA's healthcare system. So once this maternity consult is placed for our pregnant veterans to have their care in the community, the VA will cover the labs, ultrasounds, OB visits, a delivery, 7-day newborn care, and 6 to 8 week postpartum visits. VA also covers prenatal classes, any pregnancy-related education, and lactation support. Also, this consult will cover all the like hospital admissions, any hospital admissions related to the pregnancy. So this consult can be placed by a gynecologist also or a primary care physician.
Do you have anything to add to that?
Yes.
Well, what I have to add is that many women veterans don't know that we have these services available, and we very much want to, we appreciate WVON for the opportunity to speak on this, to be able to continue to promote the fact that we do have services, maternity services are within the benefits package for women veterans, and that's something that they can talk to their doctor about to follow up on and be connected to our maternity coordinator if needed.
Now, is it different in any way of the veterans from the VA services than what you might see in a civilian hospital, Isa?
I do think it's a little bit different. Right now, we don't provide labor delivery, but we do provide services up to the first trimester. I do think different to a civilian hospital, there aren't necessarily maternity coordinators working to sort of develop wraparound care for a woman veteran and follow up with her, from the time she's pregnant throughout her journey postpartum, and that is something that is available throughout the VA, in addition to the fact that those benefits are being expanded up to 12 months versus just the first trimester going forward.
I want to experiment with your audio just a little bit because you're coming a little bit muffled in my headset. Are you on speakerphone by chance?
I am not.
Actually, try speakerphone because you actually sounded better. That one second there.
Is this better?
Actually, loud and clear. That's perfect. I like that.
Sure.
So yeah,
sure.
Actually great. So then now, once again, just kind of go over it even briefly because I heard some of it but didn't get all of it. So it said it's a little bit different. There's some extra things that are added to the VA that you don't normally get in a civilian hospital.
Yes. So In a civilian hospital, pregnant women don't work with a coordinator, someone that could assist in all the nuts and bolts of what it means to go through pregnancy. And so that's a unique benefit that we're able to offer, and most VAs are able to offer. Praseetha is with us. She's a full-time provider to be able to provide maternity care coordination. Right now, those services are offered for the first trimester, but the VA is expanding those services to be available for up to a year.
And I would think it would be more cost-effective than going through a civilian hospital, even if you had insurance, whether you were covered by a job or if you had insurance through your employer. I would think the co-pays and things like that would be much cheaper. I was in the National Guard. I wasn't deployed for more than 6 months. I don't qualify for VA services. How does that part of it work? Are you familiar with that at all? Either one of you?
The co-pays, if veterans, those who pay co-pays to VA, they continue to provide. Need to pay the co-pays to VA, but not to the community provider. But if the veterans, they do not pay any co-pays to VA, they don't have to pay that. And if they need to pay co-pays, it should be after the delivery, not during their pregnancy time.
Mm-hmm. So, doctor, can you tell me a little bit, nurse, can you tell me a little bit about the lactating process? So how important is that, and what are some of the benefits or some of the services you provide for lactating mothers?
Lactating mothers, so we provide a lactation package that includes like a breast pump, nursing bras, and nursing pads that we usually give around 30 weeks of their pregnancy. And also, I usually contact them regularly. So after their delivery, when I contact them, if they have any issues with the breastfeeding or any concerns, we always connect them with the lactation specialist in the community. So that's one of the services also covered under this maternity benefit. So we always encourage all our veterans to breastfeed and for at least a year. This is if they have any issues, they can always reach out to the maternity care coordinator, and that's me, and we can connect them with the lactation specialist in the community.
Ms. Brodsky, now you mentioned about the patient care coordinator, and that's something that's different from what you get in the VA versus what you see in the civilian center. What does a coordinator do? We talked about it a little bit in some previous shows, but in this particular case, what would the coordinator do to help a woman give birth and have a safe and healthy pregnancy?
Sure. So for us, within the VA system, we have maternity care coordinators, and they kind of help navigate maternity care inside and outside of the VA. When it comes to labor and delivery, it's coordinating outside, but they assist with both physical and mental health care needs and access maternity resources, just like Praseetha was talking about, sort of being able to assist with literal items, to assist with breastfeeding, but also with coordination. If someone needs additional support, whether it's help with nutrition, help with physical therapy, sort of bodily activities, exercise, what do we need to do? That sort of care is coordinated through a maternity coordinator. And they also help with maintaining care after delivery, making sure that if someone is externally connected to a hospital, that when they come back post-delivery, they're hooked up with gynecology, they can continue to maintain the follow-up that they receive.
That's pretty good. I like that. So it's kind of like a concierge in a way of trying to coordinate all the different care and things like that. And so
Absolutely.
Do you see that your patients really appreciate that? Do they expect that, or are they kind of surprised by it? I would think that maybe even a first-time mother who hasn't been through the process before, hasn't been through a hospital before, how do they react when you provide all these services and things like that?
They're always thankful for that, following up through all their appointments and making sure they are getting the enough care they need outside the hospital, like in the community, and also in the VA. If they need any additional services, I always reach out to them, or they can reach out to me. And if they need any mental health services or like any specialty service like occupational therapy, physical therapy, or they want to hook back with their rheumatologist, so any services they need, they can always reach out to me, and I will connect with them, and they are always thankful to what we provide.
Now, Nurse Harilal, you had talked about before postpartum depression or postpartum issues and things along those lines. Walk us through some of the things that mothers need to be aware of with that, and then also how does the VA address that?
During my phone calls, I screen them for depression. So I ask questions. So depending upon their reply, that's how we assess the depression on my calls. And then if it's positive, I will connect them with a mental health provider. Sometimes they already connected with mental health provider. So in that case, I will alert that provider. If not, if it's like a new patient, I will connect with the mental health clinic and they will reach out the patient and they will do the further follow-up for that patient. So it's, the pregnancy is a time, there are many hormonal changes, the mood can change. So it's always important to assess our pregnant veterans for their mental health changes and once we assess it and we make sure we connect them with our mental health providers.
Now you guys have a town hall meeting coming up this Wednesday. Is that correct?
Yes.
Okay. Ms. Brodsky, tell us about that town hall meeting. What are you going to talk about? And then what are some of the things you're going to make sure that people walk away with when they leave that town hall meeting?
Sure. So we do have a town hall this Wednesday specifically for maternal mental health. And in that town hall, we're focusing on sort of what are the issues that affect pregnant, postpartum women veterans or women, and it happened to be women veterans. And so we're going to have representatives from women's health, from gynecology. We're going to have, we have a program within our hub specifically for reproductive mental health services. So that's another thing that's available. We've got groups available specifically for postpartum women in this period, in this transition period. We're going to have representatives on the line there to be able to talk about that, answer those questions, and just sort of share some of the services that we have available specific for women veterans that many people may not know about. We do 2 town halls a year specific to women veterans, and we really encourage people to listen in, to hear more, ask us questions, and join us for a two-way conversation with us in leadership.
Now, you mentioned, Ms. Brodsky, that you can any veteran can use this service. However, say you're a male veteran, you're a veteran, you're male, but your wife is pregnant. Does she get services from the VA, or could she get services from the VA?
I'm not sure specifically about services. Praseetha would be able to answer that question, but I will say that we have had males with pregnant women, male veterans with pregnant spouses be able to receive some support at external baby showers, et cetera. And if they need assistance, they could follow up with us.
Okay. So Nurse Harilal, can you add to that?
Yeah, so can be a patient that's the spouse of spouse of veterans. They are not qualified for this maternity services.
Okay, but they can still get some of the counseling, some of the maybe the social services,
right?
Things
Yeah,
like that, which I imagine to be important.
Yes.
Yeah.
Yes. Uh-huh.
Okay. So one thing also to want to ask you about. So was one thing that you could tell a woman veteran? What is the one thing that if you wanted to make sure that they knew something, understood about the program, what is it? And that's for either both of you. Actually, both of you. What will be that question? What would be the answer to that question?
So a healthy pregnancy should be a first gift you give your child. So let VA help. So if you're pregnant, please reach out to us. Our Women's Health Clinic phone number is 312-569-6246. So you can reach out to me or your PCP and let us know, and we are here to help you.
Ms. Brodsky, what would you like to add to that?
I would like to add that we are continuing every day to work to improve the care we provide to women veterans. I want women veterans to know that every VA is mandated to have a women veteran program manager in their facility. We do have a National Women Veteran Call Center at 855-VA-WOMEN. And when they call, they would be connected to a women veteran program manager. We can help with, connecting to a maternity coordinator. We care for our women veterans. We see our women veterans. Their voice is heard and is as important as anyone else's.
And Nurse Harilal, so you work with women all day, every day. You work with, and you're a nurse, so you understand the medical complications that occur during pregnancy. What are if you were to give someone some information or want them to be careful about certain things, what would you advise pregnant women to do to make sure, what's the most important thing I would say that you would advise pregnant women to do to make sure they have a healthy child?
So, make sure you follow up with your OB on regular intervals and make sure you do your the test during the pregnancy, like blood glucose test or the blood pressure test. So make sure, all the care should be followed up through the OB provider. And if any, during the pregnancy time, things in the complication of it, like gestational diabetes or preeclampsia, blood pressure during the pregnancy time, that can cause problems, during pregnancy or after pregnancy. So the screening and assessment by the OB provider is important. So make sure keep up the follow-up appointments with their OB provider and follow through the care. So make sure you take enough rest, follow the diet, and follow the instructions from the OB provider.
And you mentioned diet. So what types of things would you advise women to do as far as changing their diet? Because I know that's a big issue and a big topic today, nowadays, because everybody's really health conscious or trying to be health conscious. And there's so much information on the internet and social media about what you should eat, what you should not eat. People are doing things like fasting now, things like that. What's a basic diet that you would advise for someone to be healthy when they're having a child?
So the things that are more important, they need to have like a folic acid, iron, and so they need to eat fruits and vegetables and all the green leafy vegetables. So things like iron-rich food or different colored fruits items and vegetables and calcium. So they need to drink milk and dairy products. All of the things are important for the baby and the mother.
Ms. Brodsky, so when you talk to clients and as a social worker, what are some of the things that you find that are more common as far as health, or not so much health issues, but mental questions or things that might affect a person's emotions or their cognitive well-being when they're going through pregnancy?
Multiple things, but I think it all depends sort of on hormones. I think there's a lot of things that people worry about when it comes to identity shifts. People are concerned about what am I going to be like as a mother, sort of all kinds of things. And I think the most important one to remember is no matter what emotional state a pregnant person is in, it's very normal. A lot of people, experience a lot of dysregulation during this time. It's a very vulnerable time. And so it's important to remind for people to know this is normal. It will pass. It's temporary. Whatever questions you have are valid. And as sort of you deliver and give birth and sort of come to yourself, you'll start to find yourself. You'll start to find who you are as a person, as a mother with child, and sort of proceeding from there.
Okay. Ms. Brodsky, one more time before we run out of time, tell us, how do people connect with the Jessie Brown VA, or if they need to find a VA in their area, anywhere in the country, what website do they go to? Who do they call?
Sure. So if someone wants to be connected to Jessie Brown VA within our women's clinic number is 312-569-6246. And if someone is anywhere in the country, they should reach out to the National Women Veteran Call Center to be connected to a Women Veteran Program Manager that would link them to services and help. And that number is 855-VA-WOMEN or 855-829-6636.
All right. And what's the website again? One more time.
It's 855-VA-WOMEN. And that's just the website. The dial number. That's the dial number.
Okay. What's your website? If they go to the VA website, will that work as well? Or is there a drop-down menu that shows them where to go to the women's clinic on the VA website?
If you go to chicago.va.gov, you will find information for us as well. Yes.
Perfect. Sounds good. I appreciate you guys' time. You did a great job telling us all this information, and it's really important because a lot of women out there probably did not know what you guys do. So Praseetha Harilal, she's a nurse and registered nurse at Maternity Care Coordinator at Jessie Brown VA, and Asya Brodsky, a licensed clinical social worker with the Women's Veterans Program Manager as well. Thank you very much.
Thank you so much for having us.
This is America's Heroes Group. We'll be right back.